My name is Pablo Estrella Porter. I'm gonna be your host together with my colleague Salman. You see Salman also in his camera. Hi, Salman. Probably to do a quick round of introductions while you also introduce yourself in the chat. My name is Pablo Estrella, as I said. I'm a medical doctor, originally from Ecuador, even though currently I'm living in Spain doing a public health residency in Valencia. I was rotating in ReAct action into antibiotic resistance as an external intern. And together with Salman, we'll be really happy for today's workshop. So Salman, please.
Thanks a lot, Pablo, for giving me the floor. Hey, all, good morning, good afternoon, good evening, from the time zone you're joining from. We're super excited to have you here. I'm Salman Khan. I'm a medical doctor based in Mumbai, India, and I'm working with ReAct, more specifically the Asia Pacific node as the Youth Engagement Consultant. Super excited to see people joining in as we speak, and over and back to you, Pablo.
Thank you, Salman. So as we start our workshop, and as we know that still some people will join, what we would do is also do a really interactive session with a mentee. So we have also with us our team from ReAct Europe joining online. So probably they'll turn also their camera so you can see them. We have Maria, Brown, and Nelly. Hey there.
Hi from the ReAct Europe office. This is Braun.
And Maria. And Nelly. Hello.
We're here supporting on the technical side, behind the scenes, and we're really excited for the workshop today.
Thank you so much. So with that, we'll start with a quick Menti. For those who have never used it before, you just have to scan this QR code. We will put also this link on the chat. And there you will be able also to participate more actively. So I'm going to share also the link in the chat. Great. And Maria will also take over with the screening of the Menti. Great. So while you join, please start with scanning the QR code, or you can go to menti.com and put the number over there. Great. We'll wait a couple seconds more. And probably while we wait also to more people to join the Menti, just to give you a bit of my background that I wanted to share, and actually this also goes with Salman. So we both have been quite active in the youth engagement side. From my personal experience, I'm also working at the Junior Doctors Network of the World Medical Association, together with the team on the Antimicrobial Resistance Working Group. And together with Salman, actually, we were in the working group from the quadripartite, which means the WHO, the World Health Organization, FAO, the World Organization on Animal Health, as well as UNEP, the UN Program on Environmental. And in this working group, we were quite active on the youth engagement. So I don't know if, Salman, you want also to share a bit on that experience?
Yes, sure. This was back in time when I was still a medical student, and I was affiliated with the IFMSA. Most of you might be familiar with the name, the International Federation of Medical Students Association. So I was representing the IFMSA in the quadripartite working group, and we worked together to create activities for the youth, organizations, and individuals worldwide, and it was a good experience. And Pablo serves as the working group's chair while I moved on from my medical student life and joined ReAct as well in this regard. So I think we can see quite a number of people joining in Menti. So if you could, give your response on what word comes to your mind when you think about youth engagement and AMR. We would love to uh, hear your responses, or rather read them. We have 3 responses so far. Creativity, listen. Oh, the responses are coming. What do you think of these responses, Pablo?
Yeah, I mean, creativity always comes to mind when we think about youth, of course. But I see that more and more responses are coming in advocacy, and that's something we will see also during today's workshop. We have the listening, the raising awareness, of course. Hopeful. That's quite nice also to hear from youth. But advocacy is still on the core of this word cloud. Energy, of course. I think something that is really key from youth is all the energy youth can bring. We have the teamwork. Great.
I also see the word co-creation, which is a very important word that we also emphasize in ReAct. We co-create solutions with youth in the AMR space, and we are super happy to see so many of you still joining in on the call. So keep on giving in your inputs. We are happy to receive them.
And we're gonna go into the next question. So, which resources, tools, and activities on AMR do you find most useful? So this open text field. So if you have used any or which ones in general you find most useful whenever you've been dealing with antibiotic resistance, sorry. So any of them. We will review a couple today. Okay, so I see we start strong with AI and also reference books. Yes. We have also from online content, the website. Also some people from their practice with life awareness with patients and pharmacists. Then we have infographics from trusted resources such as WHO, CDC, FAO reports and guidelines, textbooks, sessions, games. This is quite nice. Okay, if we can probably scroll a bit down, that I see there's a bit more responses. Medical records. Also the app from WHO, papers and guidelines, audiovisuals. From other people, this is quite nice, this last one, passionate people. And with this, I'll take over again to go to already the start of the presentation, but don't worry because we will come back again to this Menti later on. So for you to get an idea of today's workshop, we're super excited because when we were discussing about this workshop, we wanted to also have this kind of training, the trainers kind of setting where we intended also to provide different tools to youth to become advocates, right? And as many of you were responding in the word cloud to co-create. But to give you some background, ReAct is an independent network that is dedicated to the problem of antibiotic resistance or AMR and was created back in 2005. It aims to be a global catalyst that advocates and stimulates for global engagement on antibiotic resistance through a different range of collaboration. ReAct has 4 nodes, one in each region. So we have one in Sweden for Europe, we have one in Ecuador for Latin America, one in Zambia for Africa, and one in India for Asia Pacific. So one of the resources or main tools that ReAct created some time ago is the ReAct Toolbox, which is a resource to support youth and communities to take action on antibiotic resistance. And today we're gonna see in this workshop how we're gonna be able to use this resource into our youth engagement activities. To put also some context of the problem we face with antibiotic resistance, when we talk or when we think about AMR, we actually realized that there's a lot of resources, information around. It is estimated that at the moment, there's more than 3,000 AMR researchers worldwide. And back in 2020, almost 2,000 publications were made just in 2020, which means that we're flooded with information, with published papers. We have so many resources coming and going every day, as well as some other guidelines and official reports, for example. So something that young people have always tried to get is having a resource that is able to simplify all this work into one single place, right? And here is where the toolbox comes to place. We're basically trying to merge together all this information that is coming into one single place. Seeing it short, we know that in the cycle of knowledge, we have to first understand the topic, know the basics. Then we can actually take some action and raise awareness. Those initiatives that we do need to measure. And of course, there's other ways to tackle also antimicrobial resistance or antibiotic resistance, that it's also through rational use in clinical practice, as well as all the infection prevention around it. And finally, policy. So these 6 areas are actually the 6 main cores of this toolbox. And we're going to go in deep a bit more on it. But first, we need to understand that the purpose of the ReAct Toolbox is actually to provide some sound information, guidance, and tools to support capacity building and action on antibiotic resistance. So these 6 areas that I just showed you before are going to be coming and going during all the presentation and during all the toolbox, because it's part of the core of this tool. So this resource has over 100 pages with information, and it's really important that it has a One Health approach. In the past, you know that AMR or antibiotic resistance was really focused into human health, but now the toolbox is really with a One Health approach. We have more than 500 quality review open access resources and more than 35 inspirational examples, which are key sometimes when we're starting from scratch to also see what best practices have happened in other places. It is also supported by an advisory group of international experts that provide strategic and scientific advice, which also gives some quality assurance to this tool. And just to put in context, more than 500 visitors have used the toolbox in the past 3 years. So a bit of the timeline, it was first thought, or the idea was born from 2012 and 2014. And it was identified this need for a place for collecting different experiences and information into one single place. It was finally launched in 2015. On 2016, it was improved the focus of One Health, including animal health, human health, and environmental health. And on 2018, this advisory group was established. 2025, it's a great moment because we want to have more support on the capacity building part, and therefore this workshop, and also more action on antibiotic resistance by youth and in communities. So we're going to give a quick review of how the toolbox works. So the toolbox you're actually going to be able to access through the ReAct page, which basically you will find here the toolbox section. And as you saw before, you're always going to have handy the 6 areas of the toolbox. So going a bit more in deep, each one of these areas, on the Understand section, you will be able to find all the information about the bacteria, antibiotics, and resistance. So here's where you're going to build your knowledge, wherever background you're coming from. So if you're coming from scratch, it's the first time that you're also interacting with these terms, it's going to be really easy for you to navigate through here. Even if you already have some health background, you're going to go more in deep into this Understand section, because it's quite tailored for different backgrounds. Then raising awareness is meant to be this inspiration and then tools for doing this action on raising awareness, education, and training as well. The measuring is key, because here you will be able to find the resources and tools to assess antibiotic use, resistance, and impact of the interventions. The rational use is quite important as well, because this will support for setting up the stewardship in healthcare and food and animal production. On the prevent infection section, you will find the support for setting up infection prevention control and limit spread of resistance in healthcare and food and animals. And finally, the policy, which is also an important layer because this is where different resources for supporting and developing and implementation of national action plans on antibiotic resistance will take place. So for you to understand how the toolbox is set up, because this is the same in each one of the sections, you will have the page with the basic information and guidance. So this information is curated by Toolbox team. Then you will have also the short case examples or highlights of initiatives that are found in gray or colored boxes. And finally, the selected resources, which are outside links. These selected resources are also super important because here you will find curated resources, which basically will take you to the different resources for each of the sections, but it will also include a brief description. It will tell you if it's an infographic, a video, a guideline, a toolkit, a game, and also how you will be able to use that resource into the specific section that you are. So this is really useful because we were saying before that there's so many content, so many information out there. So these selected resources would be this curated information for you to actually take action. And also something important that it's reviewed periodically. For also being more inclusive, we also have the tool on automatic translation by Google. So there you can also use the information from the toolbox in different languages. So going more into a tour, and we're going to be more practical here. Let's say that you and people in your community want to know more about antibiotic resistance. Let's say that probably the knowledge level of antibiotic resistance is really basic. So you can actually start from the basis. So in the understand, as I was saying before, you will find the basics of bacteria, of antibiotics, how antibiotic resistance work, how did we end up here with the AMR topic, why should I care, and what can I do? So one of the resources that I wanted to show is this tool that it's called Bacteria World, which is a really nice interactive website. Whenever we're willing to talk about antibiotic resistance, sometimes we need to come to the basics, and having this kind of resource which has engaging ways to learn, teach, and engage with science and bacteria is quite nice to start the topic, right? Or to start this first engagement with bacteria and also the mechanisms of resistance. So in this first section of Understand, you'll find different resources which you would be able to use, for example, for setting the ground, whichever is your public. Then, if we go a bit deeper on the understanding and setting the basis, you will find that on the antibiotic resistance, you will be able to find the different ways on mutations, resistance mechanisms, and so on. And this is quite nice because first you will find the information distilled by the team. And for example, whenever we're talking about mutations that can provide resistance to antibiotics, this infographic made by the team is quite useful because we'll show you and will help you also transmit this information of how resistant bacteria are already in the environment, but with the positive pressure that antibiotics put into our body, or those who are using the antibiotics actually are pushing into having a population of more resistant bacteria. So this kind of infographics are there in the Understand section, but some of the resources that I wanted also to bring is this one, that it's a report from FAO, which also shows you the drivers and dynamics of antimicrobial resistance in animal production. Because as I was saying before, it's as important the human section as well as the animal and food. And here you will find also a quite nice resource from FAO on how is all the antimicrobial usage in animals, humans, and agriculture, and the dispersion of antimicrobial residuals. But let's say that now we want to set a campaign. Now we understand much more the basics of antibiotic resistance, or our community knows much more, but now we want to set up a raising awareness campaign in my own network. So how can the toolbox be this resource that helps? So if we jump to the second section, which is the raising awareness section, as I was saying, here you will be able to find quite some inspirational tools that will help you start from scratch. Let's say that this is the first time you're having a contact or you're leading a campaign from zero. So this is really useful because you will find the whole 5 steps project management cycle, which means that first you need to engage your population. You will assess what's the current status or the status of the art of the knowledge of the population you're gonna intervene. Then you have to set up a plan. You will implement, evaluate, and then you'll repeat. For those who are not aware yet of this cycle, actually, this is part of the raising awareness setup campaign sections, where you will be able to see in deep each one of these sections and also the tools and resources that will help you to set it up. So just wanted to share also one of these resources that it's over here, that is the Building Coalitions for Containing Antimicrobial Resistance guide. And this is super useful tool because if you're starting from scratch on this raising awareness campaign, you will be able to have a map of key influencers. This will be community leaders, youth organization, among others. If you need to mobilize support, you will also have a form, how to form a campaign team with clear roles. And even some quite useful templates such as the stakeholder interview guide, prioritization worksheet, a kickoff meeting agenda, even for the first meeting that you're going to have with your team, and also why it's useful, because it will help you amplify the campaign impact through this strategic collaboration. But it is as important as implementing. And I'll hand over now to Salman.
Yes, thank you so much, Pablo, for giving me the floor. Let me just set up my screen sharing. So as Pablo mentioned earlier, it's as you know, we talked about how campaigns are important and how ReAct Toolbox also offers you the space to explore different campaigns and explore different ways to engage with people. And now we are at the implementation section of the toolbox, wherein you can you have the time to take action and implement your plans, your advocacy and campaigning plans. We have mentioned Plan, Do, Study, Act cycle adapted from the Institute for Healthcare Management, wherein plan is about preparing an action plan for implementation. Do is trialing the actions or trying out the actions in a specific unit or area with a certain group of people. Study to compare the baseline and then the progress measures, and then act, which is take action depending upon the results. So I'm going to move on to the next slide and show you an example support resource, which is by the WHO. Its purpose is to provide you with guidelines which are strategic for planning and expanding successful interventions, which has a 9-step framework. Moreover, apart from the implementation section in the toolbox, we also have a monitoring and evaluation section. As we know that monitoring and evaluation are integral parts of any awareness raising initiatives, and results should be fed back to the interested stakeholders in a timely manner and in a format that can be interpreted and used by the respective parties. So in the toolbox, you will help understand things like what to measure, how to collect and record data, who will analyze and interpret data, how to feedback results to different stakeholders, and also taking action on the results. But moving on, you might have a question, okay, you have the knowledge, but you need some examples to get ideas and you need inspirations. Don't worry about that. We have them mentioned in the campaign section too. And I'm going to show you some resources that are already there in the toolbox. The first one is the World AMR Awareness Week, which is a campaign site by the World Health Organization that every year provides you with resources and campaign materials to facilitate activities during the WOW week. And it also offers you the opportunity to share your activities and best practices online. And the second resource is developed by us, which was a campaign, Act on AMR Now, from people to leaders, Act on AMR Now, which was a global campaign to amplify voices of communities and civil society before the United Nations high-level meeting on AMR that happened last year in September. So if you click that resource, you can learn more about the campaign, You can find the campaign toolkit as well as inspirational initiatives. Um, then we have the next campaign, which is Super Amma campaign for changing hand washing behavior. It's essentially a behavior change communication campaign to encourage hand washing with soap. And this intervention showed that substantial increases in hand washing with soap can be achieved using emotional drivers. Um, and there's another resource called Beat Bad Microbes, which was organized by the University of Reading and the Rwanda Community Pharmacists Union to raise AMR awareness and to provide essential materials for pharmacists to better support community members. The last two are resources are toolkits, which provides guidance and strategic advocacy, as well as infographics, videos, and posters. So as you can see, we have a variety of campaign materials as examples and inspirations for you in the toolbox, catering to a variety of population group. And no matter what background you come from, be it medicine, be it public health, dentistry, veterinary, environmental sciences, or from a non-health background, the ReAct Toolbox can be a one-stop resource for you to get initiatives you can be inspired from. Moving on, you might need tools to measure impact of the intervention. So where can you find information on them? For that reason, we have the information collected in the measure section of the toolbox, where you have guidance and tools to help measure various components related to AMR as well as the impact of the interventions. So in the measure focus area of the toolbox, you can find guidance on how to generate data on various aspects of antibiotic resistance in humans as well as animals. So having accurate data, as I said, is crucial to assess the AMR situation and to determine the impact of the interventions. And the measure focus area will cover on different categories, including how to measure the burden of AMR, how to measure the consumption of antibiotics, the appropriate use of antibiotics, infections, quality of antibiotics, as well as knowledge, attitudes, beliefs, and practices. The next slide is about another support resource developed by WHO on hand hygiene monitoring tools. So the ReAct Toolbox has different interactive tools to visualize data that are available in the area of AMR. And these visual tools are designed to provide data to the user's own choice. So, these interactive tools can aid in visualization and interpretation of complex data sets that are available in the internet out there. And these interactive tools have the possibility to increase the interest and provide you a different or a nuanced type of understanding other than the conventional presentation of data forms. So this will allow you to increase your understanding, and it will allow you to not only increase your understanding, but view or not to view certain data depending on your preferences. And then this is the next slide, that is another support resource, which is the Global Point Prevalence Survey, which consists of tools and feedback for point prevalence survey on antibiotic use and resistance. And then, as you can see, there is more details about this you can find on the toolbox. Moving on, you will also need educational materials to reach out to a different group of stakeholders in your campaigns. Don't worry about that. We have you covered as well. We realize that education is an important component of efforts to mitigate AMR, and hence we have education and training section in the toolbox. And this page collects freely available education and training materials on topics related to AMR as well as antibiotic use. So resources include, let's say, curricula, online courses, training manuals, teaching modules, which are targeted towards public health professionals as well as animal health professionals. And the education materials, as you can read on the slide, are divided into many categories, including including school children, teachers, and the community. Food production, infection prevention and control for humans, educating providers, rational use and stewardship in human healthcare, as well as general open online courses. An example that I could, elaborate is teaching AMR in schools. So there's a facilitator pack resource available with playing cards in the toolbox, wherein we have education materials, facilitation manual designed for teachers, educators, facilitators, and students to learn at their own pace and plan their AMR related education sessions in the schools. Uh, Now let's move to the crux of the session. But what about youth engagement? So this is why we're having this workshop, to proudly present you that we have a new section on the toolbox on youth engagement. And we quickly go through the principles of youth engagement with you, as all of you are youth champions and consider yourself youth champions or young warriors against AMR. So what is youth engagement? As we know, youth engagement refers to the active, meaningful, and empowered involvement of young people in decision-making processes, community actions, and initiatives. Youth engagement creates spaces where youth values and voices are heard and acted upon. And this fosters partnerships that recognize youth not only as beneficiaries, but key stakeholders and key agents of change. And as you know, youth are typically aged between 15 to 24, and in many cases up to 35. And we bring energy, we bring creativity and fresh perspectives for addressing global challenges like AMR. And young people like us have already been significant stakeholders in global health, as you already know, through global climate strikes, organized advocacy efforts, and grassroots activities. We have mobilized masses and influenced governments, and we continue to influence governments to prevent policies to address the impacts of climate change. Similarly, youth-led initiatives in road safety have promoted stricter traffic laws, awareness campaigns, and better infrastructure to protect pedestrians. And in the mental health space, we have worked to break stigmas surrounding mental health and expanded access to support services and promote well-being. So if our activism has led to such significant policy changes, improved education, and global health issues, why not use our own voices to drive meaningful change in the field of AMR? So youth leadership does matter in tackling AMR, because we can drive awareness, policy change, and sustainable solutions to address this growing issue which we are currently facing as we speak. And the benefits of youth engagement in antimicrobial resistance, we've just mentioned 4, but we can't count the number of benefits because they are countless. We spread information through peer networks, social media, and local communities. We as youth develop leadership skills and push for targeted advocacy and policies. Not to forget the fresh thinking and novel strategies we bring to combat AMR through innovation. And last but not least, we are ready to form collaborative bridges and partnerships with other generations of humans living with us, with institutions, with professionals, and of course with fellow youth, to ensure there is a more inclusive approach in tackling such a big issue like AMR. And of course, as we move to the next slide, we'll come across the principles of meaningful youth engagement, wherein youth actively participate in planning and decision-making processes with which are participation and involvement. Youth access the necessary tools and knowledge to influence outcomes. And hence, empowerment is a basic principle of meaningful youth engagement. As we move on to the next principle, which is collaboration, partnerships between youth and other stakeholders ensure mutual respect, shared objectives, and co-creation of projects in tackling AMR. Diversity and inclusion is a principle that we should never forget, because youth is not a homogeneous group. Hence, diversity in age, gender, culture, your socioeconomic status, as well as abilities should be embraced. We also have mentorship and guidance as a principle of meaningful youth engagement, because support is needed for youth to ensure sustained engagement and growth. We talked about the principles, we talked about the benefits of youth engagement, but there's also something that we want you to make the best use of and reflect accordingly. Some of you may know this ladder, some of you may not know this ladder. So let me walk you through this very quickly. So this is Roger Hart's ladder of participation, which is a model that highlights the varying levels of youth involvement in our decision-making processes, and thereby emphasizing the importance of meaningful youth engagement. Now, as you see, this ladder consists of 8 rungs, and these can be divided into 3 categories. As you can see, the lowest 3 in red, these represent non-participation, where youth are either manipulative to serve adult agendas, or used decoratively without real influence, or given token roles with minimal power. As we move a bit higher in the ladder, the middle levels involve degrees of participation where youth may be assigned roles with information or may be consulted with their opinions while adults still retain control of activities. Or youth are engaged in adult initiative projects where decision making is shared. Uh, the highest levels, as you see on the ladder, they reflect and signify genuine or meaningful youth engagement or youth participation, where youth initiate and lead projects independently or share decision making power equally with the adults. This framework is important for us because it underscores the need to move beyond symbolic participation and advocating for authentic or genuine youth engagement that empowers young people to share decisions and shape decisions that affects their lives, including AMR. So this is also added in the toolbox for you to go through it, reflect, see whether you are being meaningfully engaged in an activity related to AMR, or if you, on the flip side, are engaging with youth on AMR, are you engaging with youth groups and youth individuals meaningfully or no? This ladder will help you understand just that in very simple terms. And despite best intentions, many organizations struggle to engage young people meaningfully, and there are multiple barriers that come into way of meaningful youth engagement, which include limited access to information, where young people often lack clear guidance on policy making, advocacy, or lobbying processes, wherein youth are left behind, feeling unprepared to participate fully. And then there's tokenism, as also mentioned in the rung of ladder, which is a significant barrier in meaningful youth engagement. And as well as exclusion from decision making, where young people are frequently consulted or included in important decisions uh, that affect their lives and that affects them. Exclusion from the decision making processes or consultation processes is also a common challenge. Many institutions have structures like youth advisory councils that sadly lack real power and influence in decision making. Additionally, let's say the absence of explicit youth engagement strategies in policies makes it difficult for young people to find meaningful ways to participate. Last but not least, exploitation of labor. Uh, Young individuals and youth-led organizations are sometimes, unfortunately, seen as merely unpaid or low-cost volunteers rather than valued contributors. So these were the common challenges of youth engagement that are also mentioned in the toolbox, which we want you to go through, which we want you to reflect, and then go back to the ladder and see where do you stand. And what you can do next, we are not going to reveal everything about the toolbox and the youth engagement section in this workshop. We encourage you to go through it, and we will help you go through the toolbox in a bit. But one of the resources that we will love to mention as an example support resource is the toolkit from the quadripartite, which is a step-by-step document that empowers young individuals and organizations to lead impactful AMR activities. So you'll see this toolkit in the toolbox youth engagement section. And that being said, before we move to the introduction session, I will quickly show you how the toolbox looks like and how the youth engagement section looks like. If someone, maybe Pablo, could you confirm you can see my screen?
Yes, we can.
Amazing. So you go to raise awareness. Once you go to raise awareness, you click on youth engagement. And there you go, as simple as that. Youth engagement on antibiotic resistance. You have what is youth engagement, the role of youth, why youth engagement matters, principles of youth engagement, the ladder of participation, which we just talked about, how to engage youth meaningfully in AMR-related activities and initiatives, ReAct youth engagement initiatives, and a special shout out to our nodes at Latin America, Africa node, Asia Pacific, as well as Europe node that have contributed significantly behind the scenes to have this toolbox come to life. And we can't thank them enough for their support. Common challenges, as we said before, strategies to assess the status of youth engagement, especially if you are an organization that works closely with youth individuals and youth organizations, and how you as youth can build your capacity through the ReAct Toolbox. So we talked about, the understand, raise awareness, measure, focus area. This mini guide will help you navigate the toolbox and how you can make the best use of the toolbox in your future initiatives. And of course, goes without saying, we have selected resources which are carefully curated for you and that will help you in AMR related initiatives. And that being said, I think my time is up and we will move on to Menti again. So we encourage you to log into Menti for a quick I would say interactive session again. Over and back to you, Pablo.
Thank you so much, Salman. It has been really, really nice hearing you and also finally seeing live the youth engagement tool. So while Maria shared her screen and all of you start connecting to the Menti, just wanted also to highlight that the idea of having one single place where we can start putting all youth engagement activities and people can come there and start from scratch and start using the tools inside the toolbox was a dream already some months ago. I remember being in different workshops and events related to AMR, and many of the concerns that youth brought was, I want somewhere, I don't know where to start. I don't know where to look because there's so many information. So actually having this youth engagement page is this first step that we were dreaming. So probably we can go to the next question, which would be, what type of content do you find most useful for the toolbox? Now that you know a bit more about the toolbox, tell us, what would you like to find more in the resources? Infographics, videos, toolkits, or guidelines, case studies or examples, online courses, database of AMR events. So you can scroll there and put how useful or not useful you find it.
We see varying opinions, and as we move with the Menti, we want to remind you that this is your toolbox now. This is your one-stop center. So you get to decide what content you want in the toolbox in the future. And I may have given you a spoiler, but we'll get to it very soon.
Yes. And while we see what you value the most in the toolbox, you'll see that when we talk about the ladder of youth engagement, actually we want to walk the talk. And these questions actually will have some reaction, and we will you will see. I don't want to spoil it, but yeah, we can probably then go to the next question. What features or support would facilitate your use of the ReAct Toolbox, such as training sessions, search features? So now that we have shown you already the toolbox, how do you, or which features, which ways do you think would be more useful for you to actually be using the toolbox? So I know some of you might be the first time that you see this resource, but we would love to hear what would make it even more accessible for you to be your trusted resource whenever talking about antibiotic resistance. Oh, so we see that training sessions is appearing there a lot. Great. We find also sessions, the advocating and infographic, tutorial examples, search features. Okay. Maybe more examples and activities. Can we scroll probably a bit more that I see that more Great. The training. So it seems that the training is coming up a lot. Training sessions and short videos. And actually, spoiler, you already have a lot of curated and nice videos for the different sections. Oh, also more training. Let's see if there's anything more if we scroll down a bit more. Yes, so it seems that training sessions seems as an important resource for people. Also, it's important for you to remember that as this resource is being updated all the time, well, we will get there. I won't spoil. Probably we can go to the next question. So for the youth engagement page that Salman has presented already, and also we saw it live, if you can put from this statement if you disagree or strongly agree, if the content of the page is clear and relevant, if the page provides useful information that can be applied on a real world on antibiotic resistance work, and if the page provides a good number of resources. I know it's the first time most probably you've seen it, but just as a first, a first idea. Okay, so we see quite some positive opinions. That's great. Okay, we're gonna give a couple more seconds. So the first one, if it's clear and relevant. The second one, how applicable it is, and the third one, the number of resources. So just fun fact, we also included there in the resources one Kahoot game. If you haven't used Kahoot, it's quite interactive tool such as Menti, even more interactive. And it's a WHO Kahoot collaboration they did together. And it's really nice for starting sessions about antibiotic resistance. So if you haven't check later on the toolbox. We can go to the next question. What key information is missing or should be expanded in the youth engagement section? So now you've seen it quite briefly. Salman also gave you some of the key topics. But from your perspective as youth, what would you love or you think there is missing that should be also included or expanded, or you would find it useful to have in this section of the youth engagement? Okay, so we find someone saying medical information. That is true that you can always find that probably a bit more in the understand section. But what other kind of information, whenever you're talking about youth engagement, what else would you like to have? Okay, so medical information. Okay, so we see also other responses on the chemical and genetic. Great, probably more fundamental information such as why AMR matters. I'm loving these responses because actually this what you would love to see is actually already there. Is not in the youth engagement section, but in the understand. We see the most resistant bacteria and antibiotics, collaborative spirit to make them interact more with others. And actually, this last I really like this last comment because having this kind of workshops where we have this interactive part also with you, and I was checking on the chat that already some of you are getting some networking for initiatives that you want to do on AMR. Actually, that's also our purpose with this kind of setting it like this. And even the youth engagement page. We want to showcase the work that you're doing and also the best practices, bring them here. More photos and videos during the session because the text was too much. Best practice examples and success stories, maybe a little bit more on how to conduct interactive on ground sessions. So this comment's quite nice. Probably, Salman, you want to comment a bit on the other guidelines that there's on the resources?
Yes, absolutely. We have a variety of resources available on the youth engagement section that will help you understand how to reach out to communities too. And we also have youth engagement resources in general. So if you are also passionate about other global health issues, let's say climate change or mental health, you can also find some generic resources that can help you adapt your activities or your initiatives to the other causes you believe in. So that's something very interesting about the youth engagement section. I see that we have, best practice examples and success stories are, some of them are mentioned: emerging resistance threats, more community engagement. These are, I would say, embedded somehow in some shape or form in the other sections of the ReAct Toolbox. And as I showed you the ReAct Toolbox, the youth engagement section, there is a paragraph that helps you navigate the toolbox. We encourage you to read that, and hence, after reading that, you will be able to navigate through the rest of the sections of the toolbox and find the resources you're looking for.
Can we go to the next one? I'm not sure. Great. Would you be interested to participate in an assessing group to review and improve the toolbox? So if there would be the chance for you to be in an interactive group for assessing and view the toolbox, not just the youth engagement, but overall. Great, so we see that there's quite some interest. Great, probably we can go to the next one. Oh, so I think this will be the last one. Yeah. Yeah, so we want also, before announcing this last news, probably if you want also to drop a bit of the feedback on the workshop, also how you felt it, it will be great. So it will still be open on the same link. Okay, we're we're seeing here the responses. And we still have one more thing to share. Oh, so we see inspiring, insightful. Also, anything we can improve, feel free to drop it there on the feedback. And correct me if I'm wrong, Maria, but I think this is the last one. There's more slide on this one. I think this is the last one. Yeah, it's the last one.
This is the last one.
So I'm gonna just take over with sharing my screen. And as promised, we have one more thing that we wanted to share with you. So while we were preparing all this work around the toolbox and the youth engagement, we realized that we had to walk the talk and actually be the first ones in the ladder of youth engagement to actually include youth, right? So we're introducing the new youth assessment team, which is a call. You're going to be the first ones actually who we're sharing this with. So we're opening a call for youth participants for the ReAct Toolbox assessment team. So the idea would be that actually those youth who want to be more engaged, learn more about antibiotic resistance, and also be in this environment where you can feel and you can actually give your valuable feedback on how to make not just the youth engagement segment, but overall the whole toolbox more accessible, more real, more interactive. This is now your time. So we also did these last questions where you were assessing a bit of how much information did you find, what would you improve? Actually, this is what we want to do with the whole toolbox. And therefore, we're launching this call. So who can participate? Actually, any student or early career professionals in any public health, medicine, veterinary science, environmental science, or other fields related to antibiotic resistance, or if you're just passionate about antibiotic resistance and global health, or even if you don't have any prior experience. So if you're interested and you find that you want to give some time to improving this great tool, please apply. We will open the applications until the 25th of April. And what would it be involved? So you will be reviewing assigned pages for the toolbox. So from the more than 100 pages, of course, we will just give you a few of them to review. You will share some structured feedback through a short form. And we will also give an optional way where we want to have a joint focus group for discussions to share these improvements, not just in a forum, but also in more one-on-one session. And especially, we want to provide this new kind of network where we're able actually to bring these experiences, this way on how people are using the toolbox back to the core and back to this tool. As you see, we're already on the 10-year anniversary of the toolbox, so it's a great moment also for building from the ground up. To make sure that actually the toolbox is this resource that is the most useful on the ground. So we'll be sharing this together with the slides and the recording. And probably one extra thing that I wanted to share is that we made this presentation and this material that we will share with you for also empowering every one of you. So you will have this presentation and ideas for you whenever you are in your network, in your community, in your local student organization, and you want to talk about AMR, to have this presentation also to share with your colleagues how to use the toolbox. Because what it happens a lot, and I've shared this from firsthand whenever I've done other workshops with youth on AMR, is that it's really hard sometimes to know where to start. And I personally think that the toolbox is a great first step, and also that it's building up together for youth. So yeah, Salman, I don't know if you want to share any more insights.
I think you covered it well, Pablo. Thanks so much for saving words from me.
You're really welcome. And thank you also a lot to all the team that is behind of setting up this workshop. You have no idea how excited, but also how much work it was to bring together so many people from so many different places. And if I can say, I think this is just the start. So really looking forward. We will be checking on your application. So feel free also to share with your friends and colleagues who might be interested in joining this team. And we will for sure see each other because the AMR world is quite small. So if you want to get more engaged, for sure we'll see each other in other platforms. So with this, I'll stop it here. And I will thank you again for joining and giving us some of your time to share about this passion that we have on antibiotic resistance. And thank you once again to the team at ReAct Europe that is helping us from Uppsala. Thank you, everyone. Have a good afternoon, night, or morning.
Thank you, everyone. Have a great rest of the week.